We're launching open enrollment this year in the middle of a pandemic. Part of what we're doing, we're sending out 4 million masks to Californians across the state. We know wearing a mask matters. It keeps you safe, it keeps your family safe, but it also brings up the reality that coverage matters. Having insurance in a pandemic is the right thing for everybody. So we want to make sure that everyone in California right now that is eligible to sign up, and there's 1.2 million Californians eligible today for financial help to get coverage. We're going to be out there pounding the pavement saying go to coverageca.com, get covered, and stay covered. Wear a mask. We just wrapped up a long election period nationally. 2 things were big in that election, amongst others, but number 1 was COVID and number 2 was healthcare. With those issues, the nation's going to be looking at California. No state has done what California has done to implement the Affordable Care Act well, and in many ways, we're the bellwether. We believe President-elect Biden's going to be looking to California and see what we're doing now to get people covered with masks, but also get people insurance coverage, because that's what the nation needs to do. Put politics aside, focus on consumers that need coverage. That's what we're doing here in California. So we're moving into open enrollment, and it's not normal. Look, usually open enrollment, I'm in a bus. I'm traveling every part of the state. This year, we're doing it virtually. But what is normal is now's the one time a year when all Californians can sign up for coverage, get coverage that starts January 1, but you want to sign up now. You sign up now, you don't go a day without insurance. In the middle of a pandemic, you don't want to go a day without insurance. So what do? Go to coverageca.com. From there, you can enroll yourself or find a local insurance agent, a navigator to help you through what can be still kind of complex. We got an 800 number. Wherever you go, though, we've got people that speak English, Spanish, Chinese, Tagalog. We got people that speak every language. They all speak insurance. Their help's free. Don't wait. Sign up now to get that coverage for 2021.
California is launching this open enrollment with the nation looking forward to a new president committed to making the Affordable Care Act work. Well, no state has demonstrated what that means better than California. At this moment, the eyes of the nation are on us as we demonstrate how to make the Affordable Care Act work and work well for millions of Californians. Now, one of the reasons California has been so successful in implementing the Affordable Care Act is that we have not allowed healthcare to be a partisan issue. Over the years, we have held enrollment events across the state, working with elected officials who are Democrats and Republicans, setting an example that health and healthcare can and must rise above the political divide. As President-elect Biden said, now is the time to heal. As we look ahead, we are sure that Californians will continue to do the right thing when it comes to preventing the spread of COVID, wearing a mask, and helping get as many Californians covered as possible. With the world's worst healthcare crisis in a century, America should be looking at ways to expand coverage and access to healthcare, and California has shown how that can be done. Covered California enters this open enrollment period with a record high of 1.5 million consumers renewing their coverage and a record low 0.5% rate increase for 2021. That low increase particularly benefits Californians who don't get financial help. But while we've made real progress in California, while California has reduced the rate of the uninsured more than any state in the nation, we still have an estimated 1.2 million Californians uninsured today and eligible for subsidies through Covered California or no-cost Medi-Cal. We can and must do more. So as part of our open enrollment, Covered California is sending masks like this to 2 million Californians, urging them to get covered and stay covered at a time when having insurance and access to quality health care is so important. These masks are a message. Get covered is a call to wear a mask to prevent the spread of COVID, as well as a public statement that you want your family and friends to get health insurance. Stay covered reinforces the importance of keeping safe, as well as renewing and signing up for healthcare coverage. Now, we've made these masks in English, in Spanish, Chinese, Korean, Vietnamese, because whether it's COVID or cancer or diabetes or HIV and AIDS, we are all at risk of health conditions, and all of us do better when we have insurance coverage. This is about getting the word out to all Californians. So these masks are part of the investments we're making to make sure everyone gets covered. Covered California will be spending over $157 million to promote enrollment this year, because we're facing both a healthcare and economic crisis because of the pandemic. Now is the time to step up, and that's exactly what Covered California is doing. So now I'm happy to introduce Dr. Mark Galley, who is not only Covered California's board chair, but also Secretary of California's Health and Human Services Agency. Dr. Galley, along with Governor Newsom, has been leading the state's response to the pandemic. And first, Dr. Galley, I'd like you to say you look really good in the mask. You look great in the mask, actually. But we'd like you to tell Californians where we stand in the pandemic and what this open enrollment period means for Californians today.
Well, first off, thank you, Peter. I have to admit, I do miss your bus and being with you in local communities across California. So why are we here? We want everyone to get covered and stay covered because this pandemic is far from over. While California has done a great job overall reducing viral transmission, we still have lost 18,000 Californians to COVID. And while much of the nation is seeing incredible viral surge, some parts of California are also rebounding with higher rates of COVID infection, and more Californians are being admitted to their local hospitals. Those who are hospitalized because of COVID and do not have health insurance or the special cost-sharing protections that have been put in place for COVID could walk out with very large bills. This fact puts a spotlight on the high cost of healthcare, which is why everyone should have health insurance. While we are all committed to beating COVID, we must also recognize that some communities are bearing a far higher burden of infections and deaths than others. This disproportionate impact of COVID is something California leaders have been tracking and tackling since the beginning. Let me give you a couple of examples. Latinos make up almost 40% of California's population, and they make up 50% of our COVID cases and nearly 60% of all COVID deaths in our state. Similarly, among African American communities, the risk of dying of COVID is 50% higher than it is for white Californians. The pandemic is shining a new spotlight on an old problem: the disparities and inequities in our healthcare delivery system. These disparities cannot and will not be accepted. Californians should be proud of this statewide effort to encourage everyone to get covered and stay covered. We know masks make a difference. Wearing a mask is not a political statement. It's about doing the right thing for our families, our communities, and our fellow Californians. Masks can save the life of someone you love, and we should all be wearing them. California is a diverse community, and we have people living with their parents, their grandparents, and even their great-grandparents. And we need to protect everyone by wearing a mask. We can also protect those with underlying health conditions by wearing masks, keeping our distance, and staying away from them when we are sick. We also know that getting covered with a quality health plan makes a difference if you do get sick or injured, and open enrollment is the time to sign up. Let's do it, California. Get covered and stay covered.
So, Mark, I want to thank you so much for your incredible leadership and also the leadership we've seen from throughout California, from Governor Newsom to the first responders to nurses and doctors. California has said, let's put the community first in responding to the COVID pandemic. Our putting these masks out is continuing that message for California and saying, we need to respond to COVID and let's get everybody covered. So when we travel the state virtually this year, the home of today's event is Los Angeles, California's largest metropolitan area and a community of diverse Californians that has benefited from the Affordable Care Act more than any other community, and yet still has hundreds of thousands who are eligible for free or subsidized coverage today. Our next speaker is a man who has been with Covered California since our very first open enrollment campaign, Los Angeles Mayor Eric Garcetti. So back in October 2013, we kicked off our very first open enrollment period with an event at Union Station in Los Angeles. Now, as you can see, Mayor Garcetti stood shoulder to shoulder with Angelenos that represented the incredible diversity that makes this city, this state, and this nation great. Now, I also need to note that on a personal note, one of the things I love about this picture is my mom's in it, over here in the lower left corner. Now, Back then, she was a sprightly 84, celebrating the beginning of the Affordable Care Act. But I got to tell you, at 91, she is still excited and proud to be part of an America that is expanding coverage and making sure all Americans get health care. So, Mayor Garcetti, I can't stand next to you in person, but it's so thrilled to be shoulder to shoulder with you virtually. Thank you so much. And can you say something about what Angelinos and all Californians need to know as we kick off this open enrollment period?
Well, thank you so much, Peter, and I can't believe it's been 7 years. What an amazing stretch of time. Please give your mother my very best. And it's always an honor to be with Mark Galley, who I've known for a long time, but Dr. Galley has done an incredible job. Worked incredibly close with him and our governor during this COVID crisis. Couldn't have a better medical leader. So thank you, Dr. Galley. And it's always an honor to be with all of the activists, all of the professionals, and all of the everyday Californians who are part of this here today. But, you know, the question you ask is a really important one, Peter. It couldn't be more pertinent this week, not only because we celebrate the exercise of democracy, no matter what person we're rooting for, great day and a great America. And certainly when it comes to healthcare, in my opinion, a very strong mandate and very pertinent this week, as literally tomorrow the U.S. Supreme Court will take up the Affordable Care Act once again. And this case isn't about some abstract legal principle. It's not some judgment or just any piece of legislation. These are people's lives. This is a matter of life, death. They're not statistics. These are stories. These are not numbers. These are narratives of real people who struggle to protect themselves, something that's been laid out better than ever before. We know that health coverage is the difference between a dark diagnosis and the promise of a brighter day. The impact of ACA in Los Angeles, though, can't be overstated. I'm so proud that California in general has had the largest drop in the uninsured in our nation, both in percentage and, of course, in absolute numbers. Something we should be very proud of for our community. But 6 years ago, we put together to launch the Covered California Marketplace at LA Union Station. The uninsured rate in Los Angeles County was just over 20%. That meant that 2.1 people didn't have health insurance. That 1 in 5 Angelinos could be a single medical bill away from an economic devastation or worse. And we knew those numbers were unacceptable. To me, they represented a status quo that could not stand. But with the help of Medi-Cal expansion and Covered California, we began to close that gap, cutting that gap in by more than that, helping 1.1 Angelinos who are uninsured to get the medical coverage they deserve and they needed. And that's what, to me, bold, smart, transformative work can do, not just on the legislative side, but on the community side. When the community comes together and neighbor to neighbor, friend to friend, colleague to colleague, has these sorts of conversations, help people realize that this isn't out of their reach. In fact, it makes us all healthier. It makes us all stronger. It makes us all more secure. And I believe that the Affordable Care Act has met that standard. It's been our vehicle for delivering critical healthcare resources to so many who never had it before. This has been a year full of a lot of pain and stress and yes, loss. We lost a cousin to COVID, and so many of us have lost parents, children, grandparents. We know that this has been a rough year. It started before COVID with the passing of the great Angelino. I hope Northern Californians will indulge me by evoking the memory of Kobe Bryant. He always said that the job's not finished. And whether it was down here when we saw that grit with the Lakers and the Dodgers this year, whether it was the grit in an election that we saw Joe Biden express, it brings us here today. The reality that getting that job finished is the responsibility of everybody. A lot of hard work. So I won't rest. We could not rest until every Camino and every Californian that can get the health care that they need, that they can make sure that if they have a team, that they get checked out without the fear of a debilitating invoice. That nobody has to rely on just their employment in order to have their health care. But truly, we envision and embody the idea that healthcare is a human right. So that's the vision we're working towards. It's been very successful in Los Angeles, but we have so much further to go. Count on me. So here's what you need to know. If you're an Angelino listening today or a Californian listening today, whether you're in LA or any place in California, you can sign up and get covered, fully covered. Covered California will give you a range of amazing options, the needs that fit your family and your budget. Certified enrollers are around the state, so visit, I hope every speaker says this, coveredca.com to get yourself and your family signed up. The marketplace is open. It's an exciting moment. It's a new day in America. Day for you. Y brevemente también en español yo quiero decir unas palabras. No hay duda que la de salud a bajo costo un impacto crítico en Los Ángeles. Es una cuestión de vida o muerte. La diferencia entre un diagnóstico difícil y la promesa de vivir un día más. Hace 6 años, cuando lanzamos el mercado de California, la tasa de personas seguro médico en el condado de Los Ángeles sobrepasó el 20%. Esto es increíble. Pero el resultado del trabajo de una comunidad. Pero con la ayuda de la Covered California, empezamos a cerrar, reduciendo la tasa de personas sin seguro por más de la mitad y ayudando a 1.8 millones de argentinos a obtener la cobertura de salud. La ley de cuidados de salud a bajo precio nos ha ayudado a una retención médica a quienes nunca antes lo habían tenido. Pero falta mucho por hacer. Debemos asegurarnos de que los 330 argentinos que son elegibles para Medicare o ayuda financiera a través de California se inscriban. Así que esto es lo que necesitan saber. A partir de hoy, se pueden inscribir para tener cobertura médica. California le ayudará a encontrar el plan adecuado para usted y su familia y le ayudará a determinar los tipos de asistencia financiera disponibles para usted. Hay profesionales certificados para inscribirle a todo el estado, así que visite la página coveredca.com para inscribirse a usted y su familia. El mercado ya está abierto, no espere, inscríbase hoy. Gracias, and with that, I'll hand it back to you, Peter.
Mayor Garcetti, thank you for your leadership. Now, I look forward to being truly shoulder to shoulder soon, but in the meantime, we're wearing our masks, safe distance, washing our hands, doing everything we all can do. And looking good, Mayor Garcetti. It looks great. So, and thank you also for sticking around to answer questions at the end, at which time will you take off your mask. So thank you so much, Mayor. So we're now glad to be joined by representatives of 3 groups. And we're joined by these groups, as the mayor said, healthcare change in California isn't just about policies. It's about folks in community, folks at the grassroots talking to friends, to neighbors. So we have groups with us today who are on the front lines of helping Californians respond both to the COVID pandemic and get access to healthcare coverage. And I'd like to start by introducing Dr. Ilan Shapiro, the medical director of Ultimate. Now, Ultimate has been on the front line of delivering quality care in Los Angeles and throughout Southern California for over 50 years. And it has been on the front line of getting tens of thousands of people coverage because of the Affordable Care Act. Now, look, we estimate that today, across the state, there are 650,000 uninsured Latinos across California eligible for financial help through Covered California Medi-Cal. We need to get them in the door. Dr. Shapiro, again, rocking the mask. You're looking great. I know you live and breathe providing healthcare for people. What do you want to say as we kick off this open enrollment?
Oh, my friend, I have had the pleasure to empower our community to do good choices. And part of the things that we have done has been at least giving the doors, and the key is to actually open that doors. And we have an estimated more than 650,000 Latinos across California that are eligible for financial help through Covered California for many who are insured to be. In California, we are approaching 1 million cases of COVID-19, 15,000 related deaths. The California Department of Public Health is now reporting that while Latinos make less than 40% of California population, they make up more than 60% of the COVID cases in our state. As we know, the Latinos keep working in essential work, essential jobs that keep our society functioning, while we are asked ourselves to be isolated and protected at home. Across the country, there are high numbers of Latinos in industries like agriculture, construction, manufacturing, warehousing, landscaping, and many more. Clearly, are one big away from having disaster. Imagine having them losing 1 day of work. I do remember the days that, actually 1 year and a half ago, Abuelita came to grandkids, and she was taking care of absolutely everybody. And I have seen her for a couple of years, and suddenly I saw her lost a lot of weight. And so that was, I asked, what's happening? But she told me, Doc, I'm having problems with, I'm going to the restroom more often than not. I'm having, I'm very thirsty, I'm very hungry. I don't feel well. And thanks to Cover California, she got an option to get insurance. She was diagnosed with diabetes. She still comes with me, taking care of the kids, the grandkids, as a family provider. Then that's a big thing. That's a true story. Someone actually, instead of going the program of having complications and dialysis, she actually managed to control her diabetes because she had the option of California. We need to remember that me as a medical provider, we aim to prevent chronic diseases rather than symptoms when we allow, and we don't want them to develop to a major thing. It's very important for me as a doctor to make sure that you are wearing your mask. That's one security way that we create a barrier against COVID-19. We all want to be protected. We want all that families to be safe and healthy. This is the best way that we can actually use it in a safe manner to make a difference for us and our community. Familia, muchas gracias por estar aquí. Estamos ahorita platicando con California y es súpermente importante entender que 150,000 latinos en California tienen derecho a Cover California y no lo saben. Muchos de ellos pueden tener el derecho a esto, no necesitan las armas o tiempo para poder hacerlo. Hay que recordar que 1 millón de personas que estamos aquí, han sido afectadas aquí en California y tenemos 18 muertes relacionadas con COVID-19. Desgraciadamente, nuestra comunidad hispana está mucho más dañada con eso, siendo 40% de la población, 60% de los casos completos en nuestro estado. Por eso es sumamente importante que todos nosotros busquemos en California ver qué opciones tenemos. Preguntar no empobrece es una gran diferencia porque ninguno de nosotros puede dejar un día sin trabajar. Por eso es muy importante poner la máscara. Que de esa manera nosotros, nuestra sociedad, nuestra comunidad avanza por el COVID-19. Muchas gracias.
So, thank you, Dr. Shapiro. And I want to note, we're living in Zoom world. Some of the audio is not perfect, but for those members of the media that want to do follow-up discussions with any of the people we've had here, we can follow up and get you one-on-one with you. Because Dr. Shapiro truly is on the front lines, and thank you so much. So next, I'd like to turn to Sonia Young Adam. Sonia is the CEO of the California Black Women's Health Project, a group that is empowering women of color throughout Los Angeles for the past 25 years by helping them not just understand how to take care of themselves, but how to lead in their community. We estimate that there's about 64,000 African Americans in California uninsured right now, even though they're eligible for financial help. And they can find out how to get covered at coveredca.com. Sonia, can you talk about how the African American community has responded to the pandemic and what this open enrollment period means to them?
Certainly, and thank you so much for inviting me into this space at such a time as we're living in this nation, the importance of us all being covered through Covered California and covered health insurance. I joined the California Black Women's Health Project 6 years ago because I'm committed to the organization's mission to improve health and wellness for our community, beginning with Black women and girls. Our statewide work focuses on individual care, community care, support, advocacy, and fighting health disparities. And as you noted, the COVID-19 pandemic has intensified the health disparities in the African American community, whether it's for someone seeking treatment or navigating the healthcare system during this time. We are seeing elevated levels of depression, anxiety, and isolation in our community and across the state. And we're anticipating what I'm calling a post-COVID stress disorder. It's quite alarming for our community. Helping people get covered and stay covered means a healthier future for us all. California Black Women's Health Project has trained more than 500 Black women to become health advocates and activists and to help our community get the care that we need. It has never been more important than it is right now to get covered and stay covered. Thank you so much for the about our community.
Sonia, thank you. And thank you and the 500 women you've trained to be out there in local communities getting the word out. People need advocates, and having those trained advocates is going to make a mammoth difference in thousands of people's lives. So thank you so much, Sonia. So I'm now pleased to introduce Connie Chung-Jo, the CEO of Asian Americans Advancing Justice Los Angeles. This organization is one of our major navigator programs in which 21 organizations anchored in the Chinese community, the Korean community, Vietnamese, Filipino community, and many other communities are helping people enroll today. Now, we partnered with Asian Americans Advancing Justice for years. Their work with these organizations share a vision that every Californian should have coverage. Today, there's about 92,000 Asian and Pacific Islanders across California, uninsured, eligible for financial help. We don't want to leave anyone behind. So I'll note our masks, we got masks in Vietnamese, in Chinese, in Korean. Because I like to say, we got folks that these organizations represent and others, they speak all these languages, they all speak insurance. But Connie, I'd like to ask you, what are you seeing on the ground right now? What's open enrollment? What's the context that we're looking at?
Sure. Thank you so much for having me, Peter. And I'd like to start by saying Asian Americans Advancing Justice is the nation's foremost civil rights movement for Asian American Hawaiians and during this pandemic. We are fighting to protect the health and well-being of our community through outreach and advocacy. Asian American, Native Hawaiian, and Pacific Islanders are the fastest growing group in California, who make up 16% of the state's total population. We are also incredibly representing more than ethnic groups that speak 30 languages. This means our language and culture. It's hard enough navigating your system and understanding when you're a native. It's so much more challenging for our community who are a majority. Our goal is to overcome these challenges, increase access to health care, and reduce disparities. Growing up in a Korean immigrant household, I knew far too many community members who did not have it health care. They would choose to forego adoption for many, many years, sometimes to face devastating consequences when an illness had gone too far. Getting covered, being covered, families. Open enrollment. So to the 5 million Asian American, Native Hawaiian, and Pacific Islander community members in California, now is the time to get and stay covered.
Connie, like everyone else, looking great in the mask. Thank you for joining us, and thank every one of the 21 organizations we work with through you to get the word out to the incredibly diverse Asian American Pacific Islander communities. Thank you so much. So, we mentioned earlier, Cover California enters this open enrollment period with a record high of 1.5 million people renewing their coverage and a record low rate change of 0.5%. Now, when you look at this map, you see people, because that 1.5 million isn't just a big number. Behind every one of them is a real person. You can go to coverageca.com and not only enroll in coverage, but hear their real stories. Stories from enrollees whose lives have been changed by having health insurance coverage. We're joined now by 3 people who are sharing their stories with you today. And I'm pleased to welcome Veronica Valdez, Angel Meza, and Lizette Gonzalez. So I'd like to start with Angel. Angel, welcome, rocking the mask. And, you know, like many Californians, unfortunately, I'm sorry to hear you lost your job and your healthcare coverage due to the recession. With your family, you knew you couldn't be without coverage during the pandemic. Can you talk about your experience getting coverage and what it means for you and your family?
All right, so good morning. I'm Angel Mesa. I was laid off in July of COVID-19. That's when I signed up for Care California. We're a family of 3, with my 2-year-old son. I'm really thankful for California because it's wake up one day and hear you don't have a job after 11 years with the company. And to make matters worse, you know, longer having health care for your family. But I know medical bills without health insurance are pretty big. So California is one that's big worry about you can make ends meet month to month. To know that my family is covered, it's easier. That's what keeps to sleep at night. Everything was able to keep us back that we used to have when we had health insurance. So it's thank you to California.
Angel, I want to thank you. Oh no, Angel, like almost everyone with coverage through Cover California, outpatient care, not subject to deductible. You go to the doctor, you don't have a deductible to leap over, and Angel's got that coverage for himself, his wife, and his 2-year-old son. Thank you for sharing your story with us, Angel. Now, I'm happy to welcome Veronica from San Diego. Now, I understand, Veronica, you worked in human resources at a hotel, lost your job at health coverage due to the pandemic. How did you find us, and what's it mean for you and your family to have coverage, Veronica? Veronica, turn off mute, I think. That classic thing. There you go. You're rocking it now, Veronica.
Okay, so what had happened is when I lost my job, I really didn't know where to turn for medical. I went online, filled out some application, and I got hundreds, thousands of phone calls. I asked a relative what I should do about medical insurance, and they referred me to Cover California. Needless to say, with all of my children, I needed to get coverage. I mean, you never want to risk with little ones not having insurance if they're sick or if an accident happens. So I was referred to an agent and they helped me out. It was so easy. They signed myself up, my family, and it means the world with everything that's going on right now. We can't be without insurance. So I got a reasonably priced plan, and I have that weight lifted off my shoulders.
Veronica, thank you for sharing your story. And I want to note, so Veronica's coverage, given and this is, you need to understand this, get help. She went to an insurance agent, helped her figure out the right plan for her. That plan means that when she goes to see a doctor, it's $5 for a visit. $5. That's all it is to see a doctor. No deductibles for prescription drugs. I mean, this is not only saving money when every month, far lower than actually she was paying, I think, when you had employer coverage, but also every time she goes to the doctor, not a big wall in front of Veronica and her family. So Veronica, thank you so much for joining us and sharing your story.
Thank you.
Finally, I'd like to welcome Lizette from Merced. You also lost your job and health insurance through the recession. How do you find Cover California? What's it mean to you and your family?
Hi, so I found Cover California through a local agent. He's very well known, and right now during these times it's very important to have healthcare coverage, especially for me since I am currently expecting, and you just never know what can happen. So I'm very happy that I finally found affordable healthcare coverage.
So Lizette, I want to be clear, expecting means you in less than a year are going to be adding to your family. Congratulations for that. I also know, Lizette, that for really good coverage, you're paying $1 a month. And again, when you see the doctor, $1 a month is what it's costing you. And when you go to see a doctor, $5. And you're now going to be having a bigger family with everything with your pregnancy covered through Cover California. So we don't like that you lost your job. We're in a recession, but we love that you're going to be having a baby joining your family, and we're thrilled we can help. Thank you so much, Lizette. So I want to thank all of these three individuals. It takes courage to share their stories. It takes courage to get the word out. They're going to be wearing masks. See the masks they've got on? Pretty soon, you're going to see millions of Californians wearing those masks. Those masks come with a message. Stay healthy in the COVID pandemic, but get coverage. Californians need meaningful coverage. And with Cover California, coverage isn't just an insurance card. You get access to the best doctors, best care you could possibly need. We want all Californians to get covered and stay covered. Continue on the path in this state to true universal coverage. So look, consumers that sign up with Cover California will have quality coverage beginning January 1. We want people to sign up now so you don't go a day without coverage. So now I want to call your attention to this board behind me. We've all been on Zoom calls with lots of our friends and family. We're doing this all the time. These individuals, 16 of them, are some of the 10,000 certified insurance agents, navigators, who are across California helping people enroll. They're woven into the fabric of communities and cities, towns across California. We asked them all to share their stories, but we don't have time for all of them. So we're gonna have 3 of them say briefly, what are they about and what should Californians know about? So I'd like to start with Jacob, a certified insurance agent. Jacob?
I'm Jacob from Santa Rosa. Covered California is important because it provides a great way for you to get health insurance for you and your family. Get covered and stay covered.
Thank you so much, Jacob. I now like to introduce Jane. Jane, can you say a few words?
Hi, my name is Jane from Pasadena. Covered California is very important because it covers pre-existing conditions. Get covered, stay covered.
Jane, thank you so much. Now, note, as a native Pasadenan, I'm there with you. You should probably have coffee with my mom one of these days. So finally, I'd like to return to Alicia from Pomona. And can you tell those in California who speak Spanish what they should know and what you're concerned about? Alicia?
Hola, soy Alicia de Pomona y los invito para que se registren en un plan de Cover California. Hoy más que nunca tenemos que cuidar nuestra salud. Amigos, por favor, no dejen de cuidar de sus familias y de ustedes mismos.
Alicia, muchas gracias. So thank all of you. We're sending these millions of masks out, literally millions, because we want Californians throughout the state to drive home the important message that getting covered and staying covered is all of our jobs. Dr. Galley spoke about this. These people spoke about it. So I want to take you back, though, to a tradition that we had at Cover California. When I was on the bus, and I've traveled a lot of miles on that bus, at the end of each event, we would ask members of the community to say something together. We're going to try a Zoom version this year. So what I'm going to ask all of you, on 3, say, get covered, stay covered. 1, 2, 3.
Get covered, stay covered.
Thank you all so much. So in conclusion, I want to thank the people from across California. We can't be with them in person today. We aren't shoulder to shoulder in body, but we are shoulder to shoulder in spirit. Because California has said we put Californians first. Californians need to know that we have Californians back. We're going to be getting the word out, and now is the time for you to tell your family, your friends, anyone you know that you see not wearing a mask, give them a mask. Anyone you know that doesn't have insurance, tell them to go to coveredca.com, which is the end of open enrollment in California. But we want people to get covered and sign up so they don't go a day without insurance. Thank you so much for joining us. Thank you, Mayor Garcetti, Dr. Galley. We look forward to connecting with all of you on our virtual bus as we travel the state in the weeks to come. Thank you.